Don't fall into the diagnosis trap. Many of my patients come to me telling me that, well, my doctor diagnosed me with this, but now what do I do? Somehow they leave the doctor with a diagnosis, but without a plan to correct it. This is particularly true when it comes to this constellation of chronic diseases. That's kind of an epidemic in the modern world. You go to a doctor, he says, well, you have diabetes. But why do I have diabetes? I don't know. Maybe it's in your genetics. Maybe it's in the environment. No one knows. But here, take this drug. That's a trap because it avoids identifying the cause of the chronic problem and reversing it and thinking that the diagnosis itself, which produces a drug therapy, is the answer. There are no drugs that cure any of those chronic diseases. I'm talking about like Alzheimer's, diabetes, obesity, chronic allergies that are so much on the rise. They have environmental causes. They do have strategies for reversing them, but none of them are drugs. What am I talking about? Well, things like dietary therapy, things like using exercise to restore capacity, restoring the dynamic dual capacity of your metabolism, altering the way that you can rebuild mitochondria, which is a core part of all of this, using strategies like hyperbaric oxygen, like telomerase therapy, like nutritional supplementation, like IV therapy, stem cell therapies, PRP, and many others that are available, but not the privy of the average physician. I've done this my whole lifetime. You want to know more about it? Give me a follow. Stay tuned.